Good morning, everybody. Your health coach is here again to help you live better, know better, and make healthier choices. On the Monday Health segment today, we'll be talking about the topic known as thyroid disease. Before we talk about thyroid disease, let's talk about the thyroid gland. The thyroid gland is an endocrine system gland. It lies in the front of your neck. It's a butterfly-shaped organ. If you picture a bow tie, that's how the thyroid gland looks like. It's just below your Adam's apple. The thyroid gland has some functions. If there's a disruption in this function, it's a signal that there's a thyroid disease in your system. One of the functions that it helps you, gives you your voice quality, because the nerves that gives you voice quality pass through the thyroid gland. That's one of the function. There's bone maintenance. It regulates the heart rate. It also helps the metabolic system. Our metabolic rate is affected by the thyroid gland. So when there's a problem, there's a signal that the thyroid is crying for help. Now there are three kinds of thyroid disease, and then there's thyroid cancer. The first we'll consider today is hyperthyroidism. When there's an excessive production of the thyroid hormone, then there's hyperthyroidism. And then as I said, it helps the metabolic rate. When there's an excess production, your metabolic rate becomes faster. So you become weak easily, you become tired, you feel warm in hyperthyroidism. We feel warm. One of the most common forms of hyperthyroidism is Graves' disease. In Graves' disease, there's an autoimmune response. The antibodies are stimulated to produce excess of the thyroid hormone than your body requires, and this leads to hyperthyroidism. But through tests like thyroid scan can be detected. So then there's also hypothyroidism. In hypothyroidism, there's a slower rate of metabolism. So it makes the patient feel cold, a shortness of breath on exercise. Then there's loss of hair. There could be a bald patch on your head. It's a classical sign of thyroid disease, of hypothyroidism. The most common form of hypothyroidism is Hashimoto's disease. In Hashimoto's disease, the immune system produces less of these hormones, or less of the thyroid hormone, and this in turn leads to slower metabolic rates. And because there's a slower rate in production of the thyroid hormone. Then we have goiter. In goiter, there's swelling or nodules in the neck, and this swelling makes it difficult for patient to breathe well. So it makes it difficult for patient to swallow. You see a visible swelling. Normally, the thyroid gland is not visible, except there's a problem. So that the swelling indicates that there's something going on in the thyroid system. Now we have the thyroid cancer. It's a very rare form of cancer, but it does happen, and there's treatment. Treatment is through surgery. Then in goiter, it could be lost. It could be an infection that causes the goiter, or it could also be the fact that there's the deficiency in iodine in the system. Include this in your diet to help you